Hello, Connecticut, and welcome to the Paid Leave podcast. The title basically says it all. I'm Nancy Barrow, and I will be delving into this new state program and how it can help you and your family. This podcast will give you information you should know about Connecticut Paid Leave and maybe just a little bit more. Connecticut Paid Leave brings peace of mind to your home, family, and workplace. Welcome to the Paid Leave podcast. World Maternal Mental Health Day is May 6th, and it's National Women's Health Week, May 10th through the 16th. And May is Mental Health Month. These build awareness, advocacy, and community outreach. And here to talk about this is Jessica Mason. She's the Senior Policy Analyst for Economic Justice at the National Partnership for Women and Families, where she oversees in-house research and data analysis, tracks developments in academic and other research, and develops advocacy resources related to the workplace and economic security agenda. She also helps find ways to engage with current and new allies in this work. And Jessica plays a key role in promoting fairness in the workplace and reproductive health rights. And prior to her work at the National Partnership, Jessica was an instructor in gender and women's studies at the University of Wisconsin-Madison and a researcher on economic justice and anti-corruption issues for the Center for Media and Democracy. She also has conducted research on gender politics, nationalism, social movements, and authoritarianism in contemporary Russia. She holds a PhD in anthropology from the University of Wisconsin-Madison. And welcome to the Paid Leave podcast, Jessica.
Hi, great to be here.
Well, tell me about your journey and your position as the Senior Policy Analyst and Economic Justice in the Partnership for Women and Families. How did you get there?
I have a little bit of an unusual background for somebody working in public policy. It's took a couple detours. So my training is actually in cultural anthropology, which is really the study of sort of the great, vast scope of human diversity through place and time. And I had been really interested in that work, in understanding kind of what's going on with gender and family and politics, broadly speaking. I had a separate interest in Russia in particular, having sort of grown up as a child of the post-Cold War and sort of seeing all of the changes happening as the Soviet Union fell apart and all of that, which we don't need to get into today. But it sort of opened up my eyes to just how much societies can change and how quickly they can change. And that's something that I've always been really interested in, is sort of that awareness that the way that we live is not the way we have to live. You know, we have choices as a community, as a society, about how we want to set things up, like how we want to make things work. And, obviously looking around the world, there are, a lot of problems, a lot of, lessons we can learn that sort of we don't want to do this or that, including in our own country, but also a lot of lessons about sort of what can work better or what we could try. And so that's kind of the, in the broadest sense, the lens that I bring to policy is thinking about how nothing about the way we have this country set up has to be that way. Like we always have choices. And so in my work at the National Partnership, we do a lot of that work in thinking about, how is our economy set up, particularly for women and women of color? Is it working or is it not? And if it's not working, we don't have to just sit back and think like, well, this is just how things are. It's just the law of nature, right? Like, no, we can take action. We can change things.
And that's powerful right there. That's a powerful thought process that you have.
Yeah. And I think that's sort of the number one lesson for anybody who's interested in, small p politics or, getting on the big DC stage, whatever level, that you have power. We all have power. Like we are making this society and we can do it differently if we want to.
It's so interesting as a researcher. What are you working on now?
Yeah, always lots of work, always a long to-do list. I do a lot of work on paid family medical leave, which is why I'm so excited to be on this podcast. In my home space, I love paid leave people. And paid leave is a particularly exciting policy area to work on because there's so much happening. We have a lot of other issues in this country where, there's a lot of division around policy or just a lot of stagnation and not much moving. And, if you look at the national level, you might think like, oh, paid leave, like the United States is still one of the few countries that doesn't have it. We're stuck for, generations. But just below the surface, and folks in Connecticut know this really well, there's been so much progress, especially the past 10 or 20 years. And so it's a great area to be working in as a researcher because we have programs that have come into play. And that means we can look at outcomes. We can see how they're affecting people's lives. So one piece of my work at the National Partnership is just keeping up with all that's happening in that space in academics and at other think tanks, kind of what people are working on, all of the great research that's happening. And it's just reams and reams of studies and reports every year. It's been really, really exciting. And then a piece of that is sort of translating all of that for the public and for
Mm.
policymakers, because you might imagine, whether you're just a busy person trying to understand what's going on in the world, like in your 5 minutes between like getting home from work and making dinner, or a staffer on the Hill, in Capitol Hill in DC, where you're working on 100 different issues. Like you don't have time to sit down and read like 20 academic research studies. So one of the things that we try to do at the partnership is, do that reading work and, how can I take this research study and turn it into like one sentence that a regular person can understand, and really get that takeaway of like, what did we learn from this great academic work? So that's one big piece of the job.
What role does community engagement play in the success of your work at the partnership?
Yeah, community engagement is key. So the National Partnership is based in Washington, D.C. We're, kind of a D.C. think tank. We've been around for a long time doing this work with really a national lens, and we pay a lot of attention to what's happening at the state and local level, to help out and to feed that up to hopefully eventually national progress. But we're not out there based in every community across the country. And when you're talking about state policy and local policy, like that's really driven by state and local concerns and needs. When it comes to creating a program like Connecticut Paid Leave, it was local people, it was workers, it was families, it was local leaders, community organizations based in Connecticut who were the ones demanding that, driving it, designing it, getting it passed. Nobody wants to hear like, oh, just some like person swooping in from DC, here's what your state should do, right? Like that doesn't work. It's a bad idea. So what we do is be in community with those community groups and local organizing efforts and try to find ways that we can support with technical expertise and resources that those local and grassroots folks may not have. So I work with some great policy lawyers on staff, for example, who give technical assistance on like, what exactly difference would this word or this word make if you put it in a statute, like that kind of thing, and sharing best practices from other states. What have we learned from laws that passed in earlier states that we can apply here to make it work a little bit better in Connecticut? And then also offering resources. So we get called up and, asked for like, hey, our state legislator was asking like, what impact would this have on small businesses? Like, what
Mm,
can you tell us about that?
yeah.
And we can hand over the research.
It's really interesting that you got involved in Connecticut Paid Leave, and that's what's fantastic. But when did it become Connecticut Paid Leave in your research? Because I think that's like fascinating that you've done research on our program.
Yeah, I was able to publish a big kind of deep dive report last summer on three of the state programs. And the starting point for that report was, it's one of these reports that took a couple of years to come together. So when I started out, my key question was really, for a number of years, we'd had California, New Jersey, Rhode Island, New York, and these are all states that, to get a little wonky about it, had way back in the 1940s passed temporary disability insurance, so medical leave. And only then in the 2000s, they started adding on top of that with paid family leave. So we had these four kind of like legacy programs that had been in place for a long time that kind of built on top of that. So that was great. And then we had a new wave of states, including Connecticut, that said like, hey, can we start this up from scratch? And so that provided a really great opportunity to take a look at what was happening with some of those new states. And so the impetus was really like, hey, Connecticut is part of this new wave. Let's take a look at some of the first couple years of data just after setup and see how is it going? Who's using it? What are the patterns? Where's use really strong? Where are, there are some aspects of the workforce that might need a little bit of a bump up? Kind of how is that use looking in these brand new programs? And so Connecticut was really a focus from the very beginning.
That's so great. And how did Connecticut stack up to the other paid leave programs?
Connecticut had some really, really strong features. I was really encouraged by, for example, And we can hopefully get a little bit more into parental leave because it's such a great piece of this
Mm,
topic. But the gender equity in parental leave. So with some of those older programs like Rhode Island, California, in California's first year of paid family leave, um, men were taking like 20% of the leave, something like that. Like it's pretty small. And so Connecticut started out just in its first year with men taking like a third of the parental leaves, which is a great start. And actually, like when I looked at just an estimate of like all of the new dads in Connecticut who were potentially eligible for the program, who met that eligibility criteria, about 1 in 3 used Connecticut paid leave that very first year, which
yeah.
is huge for a brand new program because you're just getting started. Like people may not have heard of the program yet. And so that's a really strong signal that number one, the state was really getting the word out, so people knew about it, and knew to apply and knew to like make the effort. And then also that gender equity piece of a substantial share of new dads being able to take advantage of that leave. And then most recently, I was looking at I think 2022 or 2023 data was the last I was able to look at. But men were filing 49% of all parental leave claims. Half.
Yeah. Yeah. Isn't that
Yeah.
amazing? I've spoken to so many dads, and we had one dad who lived in Florida, had their first child, and decided, he and his wife, that they really wanted to move to a state that had a paid leave program. They moved to Connecticut because it's such a strong
I love
program,
that.
and he's our poster child now for parental leave. So it's so encouraging, and we hope those numbers go up. We want people to be able to bond with their child. We know that it helps the child and the whole family unit, and everybody benefits from both parents taking leave. So we hope that number goes up and up and up because usage is definitely going up and up and up every year.
Yeah, that's such an important point. I know your listeners might be wondering, I work at the National Partnership for Women and Families. Like, why do I care about dads taking leave? But, we really find that, to get to, a golden future of like great gender equity, we really need to work on two things. We need to work on making sure that women have kind of full and fair access to the economy, to political life, all these great things. And that also includes men getting to do their share of caregiving and being fully involved in family life. And we know from a lot of survey work that, especially in younger generations, like men want that equality. Like, they want to be breadwinners, but they also want to have time with their kids. They want to take care of their parents as they're aging. They want to be involved in these things. And for too long, we've had policies that don't make that possible. Like without paid leave, you have a lot of families where if you're in a heterosexual couple, it's like, well, we can't lose both our paychecks. So if we're going to take like unpaid time, like it's probably going to be the woman taking off because of, pay discrimination, right? She might be paid a little bit less in the first place. And then we're making that really hard choice. Well, like one of us gets to do the family time, but, is missing out on retirement savings and career
Mm.
advancement. And the other one is like doing all the earning, but like misses out on these like key milestones in their baby's life, right? And those are really impossible choices to be forcing on people.
Just impossible, right? You mentioned caregivers. I love that related by affinity. Did you find that was a really important caveat to Connecticut paid leave as well?
Yeah, it was one of the things I was excited to look at because Connecticut was one of the first states to be able to incorporate that and to have it at the very beginning. Kind of built into just the DNA of the program at the start. And we know from other research that chosen family, that related by blood or affinity kind of language, that broadness, is really important to just reflect the reality of people's caregiving lives and their family lives. To get like a little bit back into history, the National Partnership helped draft the Family Medical Leave Act. We helped pass it in the first place, and back in 1993. And that still is the nation's only national leave law, and it's unpaid. And even if you're eligible for paid leave, if you need it for family caregiving, you can only take it for a spouse, a parent, or a minor child. And like, let's be real, most people have other folks that they care about beyond that little set right there. Whether it's in-laws, whether it's siblings, or whether it's chosen family. And we see, especially in certain communities, for example, LGBT folks often really rely on chosen family, particularly, if they're in a tough situation where perhaps, their birth family might have disowned them or something, really, really traumatic. And they've built other networks of support and mutual care. And so, we should have laws that like let people have the families that they actually have, not some kind of like family that we pretend people have on paper. We also see chosen families especially important for disabled people who, you know, if you maybe like live away from your blood family, like maybe your roommate is the person who's like able to take you to the doctor. Or, maybe you have other chosen family members who, really close friends are your, most close people who you trust to help with those medical needs. And then a third population, and I mean, a lot of people affected by chosen families. So I kind of like to go a little bit down the list.
No, but it's
But
great. It's so inclusive, and that's what I think I love about that our program. I think that's such a beautiful
yeah,
thing.
yeah. And then digging into the use data, I'll say like, I think people get a little nervous when they hear about new approaches to policy. And, there's always someone in the negotiation room who's like a little scared and trying to kind of come up with like, oh no, like how could this go wrong? And so with chosen family and kind of broad family definitions, there's often someone who's like, well, is this going to be like some kind of like open door for abuse or something? And if you stop and think about it, you think, well, like, okay, this is still a program where you have to fill all these application forms out. Like you still have to have like a medical need, like,
Mm.
and honestly, if someone was just like pretending to really care about their neighbor so that they could take their neighbor to surgery and help them recover afterward, like, well, that sounds nice. Like, what a great world. But in reality, what we see from the use is like it's a modest share. We're talking just a couple percent of the total family leaves. Like, it's not like people are beating down the door to like suddenly claim chosen family or something. So it really reflects like this is something that's in the program that is so meaningful to some populations of people, but doesn't actually like add a lot to the program cost or anything. Like it's very straightforward to do.
One of the things that we're proud of is that this program was built on time and under budget. How does that compare to other programs that you've seen pop up and crop up? Has it been more difficult for other programs? I mean, we did it, our CEO at the time, it was like right in the beginning of the pandemic when she was in. So she had to do this all remotely, which was really amazing.
Yeah, what a tough time to roll out a whole brand new government program from scratch, right? Yeah, we love to hear on time and under budget. I think Minnesota, which just started paying out benefits earlier this year, had the same experience of on time, under budget. We love to hear it.
Right?
And one of the great things that's happening is because these programs have been expanding in more and more states now, the folks who run them like talk to each other. They share ideas, they share best practices. And so one of the things that we've been able to see is that when new states pass programs, the great state employees who are setting them up like reach out to the other states that have recently gone through that experience to say like, okay, like what worked, what didn't, what can we learn? And so getting that like community of learning across different states has been really great. And we see that that has really helped kind of speed up and smooth out the implementation from state to state so that, states aren't like repeating the same mistakes. And, it gets like really in the weeds around like, do you make sure you get all your procurement contracts and, RFPs out on time and all of that good stuff? Like, how do you set up your computer system so that on day one, they don't blow up, right? Like,
Right.
we want to make sure the application form works. And so states being able to share with each other those lessons has been really, really key. And for an organization like ours, we're also like, thinking with an eye ahead. Not only like how can we help share some of those best practices from state to state, but also like what can we learn so that we have great lessons to take when at some point we get a federal program so we can make sure that that gets set up and on time and under budget ideally,
Yeah.
and in
That'd be
in a smooth
great.
way so that on day one it's like ready to go.
Let's talk about that because I think that's the $1 million question, right? What have you found out about why we don't have that national paid leave program? And when it got close, it got down to 2 weeks.
And what we see at the partnership is, a couple of really big drivers of why that's been so hard in the US. Like one, the US has a little bit of some of it is like an ideological bias that I think over time has been shifting. But for a long time, a lot of policymakers really took for granted that like this stuff just isn't the government's job. Like just let families figure it out. And that I think comes down a lot to the fact that these sorts of caregiving issues are really falling often on the shoulders of women, particularly women of color. And so people are just sort of used to like, oh, like, well, yeah, like the new mom will just stay home and take care of the baby. Like that's fine. Or like if a family can't afford it, they can hire out to a really underpaid, childcare and elder care workforce that is mostly women of color. And there's just sort of a devaluing of that kind of work. It's not taken as seriously, it's not really supported, and it's just sort of seen as like, yeah, 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 like individual people should just figure this out on their own. And I think that attitude has been shifting a lot, and we certainly see it like being proven out in the States. And when you look at something like the affordability conversation happening right now, like there's a lot of people who no longer think that having like incredibly unaffordable childcare is just an individual issue, right? Like we recognize that's having a high cost on our whole society. Like when we don't support these things, it keeps women out of the labor force, and that like lowers our GDP. It means like employers are losing really valuable, trained, experienced employees because they don't have those supports. So I think there's a broadening recognition
Mm.
of how much it costs not to do these things.
Yeah.
And that helps us, I think, tell the story of like why it's worth the investment. The price tag might look really big on the surface, but like let's think about all the costs we're paying right now by not helping families, meet their own needs.
What have you found out about maternal health outcomes and Black maternal health outcomes?
Yeah, this is such an important issue. And I think about this in kind of two parts. First, kind of why the need is so strong, and then also on the benefits of paid leave that have been really proven out. So, on the first part, we know that across the board, people are going to need leave, whether they have a new child, whether they have a medical need, family caregiving. But a lot of the factors that drive those kinds of needs are a little bit kind of extra and systemic for people of color and particularly for Black women. So when you think about, who is due to legacies of redlining and segregation, living in neighborhoods that have more exposure to environmental harms, or who is pushed into jobs that have either, bad health exposures or are really physical and are really difficult and are taking a toll on people's bodies. And then add to that the toll that experiencing racism and sexism really takes on people's health, which is a really physical thing. So because of all those things, Black women are already at higher risk for a whole host of health conditions, including things like hypertension that are really risky during pregnancy and postpartum. And so the need that Black women have for paid leave, for adequate time, for pay, for the ability to like really rest and recover and like properly take care of their pregnancies and postpartum stage, it's, at least as strong, if not stronger, than a lot of other groups. But at the same time, when we don't have public policies in place that guarantee paid leave and it's just left up to, individual employers in the boss lottery, Black women are less likely to have access to paid time away from their jobs. So you see sort of like the need is strong and they're less likely to have the support, which is horrible. And then like the capstone is the economic inequalities that, discrimination in the labor market, pay inequities, the racial wealth gap, all of this means that Black women also on average have fewer resources to be able to rely on if they have to take unpaid time. So it's just this really like kind of hit in multiple ways kind of situation. And the upshot is in states that don't have paid leave, we see that nearly 40% of the time when Black women need to take a leave, like when they have one of those serious health conditions or have a new child, they don't take the leave. Like they need it, but they can't take it at all. So they're foregoing medical care, they're like delaying treatment for things, like it's unconscionable, right?
Yeah.
And then another 40% of the leaves that they do take, they're taking with no pay. But I'll end with like the positive, which is we know good policy can actually help all of these things, right? This is not stuck in stone. We know from the research that paid leave like reduces the likelihood that new mothers will fall into poverty, right? We can keep those incomes stable. And that in itself has good health impacts. It reduces stress, it reduces strain, it improves mental health. We know paid leave reduces low birth rate births, which is, good for the infants, but also just a good signal about what's happening in terms of pregnancy outcomes. And there's some great recent research, for example, finding that state paid leave for postpartum women who have hypertension, which, as I mentioned, disproportionately affects Black women. State paid leave programs led to fewer inpatient hospital visits and more outpatient treatment and medication adherence, which means like we're seeing a shift from people being forced to kind of wait until they're in crisis mode and like go into the emergency room and like be in the hospital.
Mm.
And instead they're able to like get treatment when they need it up front and have kind of be able to intervene earlier on. So those kinds of things, really do make a difference over time. And just, having that pay, having that time to seek treatment and to like actually rest and recover and like hopefully get to enjoy your pregnancy and your new baby rather than be stressed about bills. It's just it's invaluable and everybody deserves it, and especially Black moms.
The partnership is 55 years old this year, right? What does that mean to you,
Yeah.
and what would you like to see happen in the next 5 years of the partnership, that what you're working on?
Yeah, it's an exciting milestone, and it's exciting to work at an organization that has such a long legacy. Obviously, I was not here 55 years ago, but it's great to be hear about the victories we've had over time, and I think it helps give us a little bit of perspective around, on the one hand, these are such urgent issues that like we want to win this stuff right away because people need it now. I mean, they need it yesterday. But at the same time, we recognize that just because we didn't win paid leave, this go around, like there is a next fight and we can continue to make progress. So we really try to take that long view. In the next 5 years, we are absolutely continuing to focus on winning that comprehensive paid family medical leave program. It's, we've been working on it for decades. Like the original vision of the Family Medical Leave Act was to have pay. It's not that nobody thought of it back then. And we continue the fight very much so. We're also doing a lot of thinking, broadly about women's health, women's caregiving, women in the economy. It's a tough time out there. It's a tough landscape, particularly at the federal level when you think sort of broadly about the job improvement and also civil rights work that the organization has done over the years. So right now, we're doing a lot of defense. Keeping an eye on like, well, what is happening at the EEOC, the Equal Employment Opportunity Commission, that is supposed to be defending, equality and rights in the workplace for everybody. So we want to, hold them to that. So we're keeping up with that kind of thing. We're fighting for reproductive health care and frankly, affordable health care, which is, a little bit under threat right now. So it's a busy time, but we're really focused on where we can make progress, even, at the state level and even incremental progress, like keep taking things moving forward.
And has there been a favorite research project or work that you've done that you look back and you're like, oh, I really loved doing that?
A little bit of a tough question. I mean, I was thinking first about just whatever I published last. It's like my little like research baby. So we did just put out a research study, I think just last week. Time flies. Finding that just about 1/3 of workers in the United States in the private sector are now covered by a state paid leave program. Which we want to get to 100%, of course. But like 1 in 3, that's really big.
That is
States
big.
are making a huge difference, just directly impacting people's lives. And I think the odds right now that like either you are one of those people who's covered by a state program or somebody who is, right? Like that's getting higher and higher. And hopefully that also helps like shift the needle for people to see like, well, gosh, like, my cousin in such and such state was able to take paid leave, but I'm not. That's not fair. So that was an exciting analysis to get out. And then I mentioned one from this is now like 5 or 6 years ago, but I was able to do an analysis finding that at that time, a national paid leave program would save us, we estimated like $60 billion in healthcare costs every year. And that was based on just a couple of studies. And there's been so much research since then. So that's not even including things like the hypertension study I mentioned, or there's some great, exciting new research happening on paid leave reducing cancer mortality. Yeah, right.
Wow.
That's really big.
Yeah, that's
So we're
huge.
seeing more and more benefits of paid leave. And so kind of helping put some, and this is sort of really, thinking a little bit strategically, thinking about policymakers, like helping them understand that when they spend money on getting paid leave to people, like number one, that money doesn't get set on fire, right? Like that goes out to people and then they pay their bills with it. But it's also worth making this investment because it like makes people's lives better. It helps families get done the things that they need to get done. And it actually has really good public health benefits in the long run.
And economically, like for small businesses, it's so important for them to have those paid leave programs available to their employees. We hear that all the time.
Yeah, we do too. We were actually able to do some polling with Small Business Majority about a year or so ago. And we found that almost 80% of small business owners would support a national paid leave program. And it's because they really want to be able to provide that benefit to their employees, but they can't really do it on their own most of the time. And so having that state program in place like helps them kind of provide the benefit, takes some of that administrative burden off of them, and then helps them compete with those bigger employers who can offer a better package.
I want to thank Jessica Mason, the Senior Policy Analyst for Economic Justice at the National Partnership for Women and Families. It was such a pleasure having you on here.
Yeah, thanks so much.
For more information or to apply for benefits, please go to ctpaidleave.org. This has been another edition of the Paid Leave Podcast. Please like and subscribe so you'll be notified about new podcasts that become available. Connecticut Paid Leave is a public act with a personal purpose. I'm Nancy Barrow, and thanks for listening.